COVID-19 is making headlines once again. While there is no reason to panic just yet, it is our job to inform our viewers about any risk that they might anticipate at this point. And tonight on GRAVITAS, we tell you about a new COVID-19 wave that has been spreading. In fact, ringing warning bells of a resurgence of the deadly wave. The world had been, in fact, reeling under the impact of COVID-19. In fact, in Hong Kong, health authorities have warned of COVID-19 activity reaching a peak. Over 30 people have been reported dead. That's the highest reported in about a year in the week through May 3. And as per the recent data provided by the Centre for Health Protection, the infection rate has climbed from 1.7% in mid-March to 11.4%. Thus exceeding the peak recorded in August 2024. And the signs have been quite glaring, with the percentage of respiratory samples testing COVID positive in Hong Kong also reaching the highest in a year. In recent weeks, time and again, health officials have constantly warned of a steep rise in infections and of COVID-19 cases spiking drastically. And this is not just in Hong Kong, by the way, also in Singapore, where a number of infections jumped 28%. to over 14,000 in the week through May 3. Daily hospitalization numbers rose around 30%. It's important to note here, Hong Kong and Singapore, two of the biggest cities there, both densely populated, inhabited by millions of people. Reporting a rise in COVID-19 cases, this is of significance. In the past few months, COVID-19 seems to have made a quiet comeback in some regions, even as it changed its nature from being a pandemic to now endemic. Waves of the disease have been swelling periodically. Above all, the rising viral load found in sewage water, topped by COVID-related medical consultations and frequent hospitalizations, signaling a clear pattern, perhaps, that of the virus spreading and fanning fears of what could lie ahead. What explains this sudden spike? Though the world thought it had long bid farewell to COVID-19, according to reports, the increase may be an indication of declining immunity, with authorities urging people to ensure they are vaccinated. But that's not all. Authorities have also repeatedly called on people to have their vaccinations updated, issuing a special reminder to high-risk individuals to get booster shots if they haven't already. Also, there is a discerning shift in the manifestation of the virus. Unlike other respiratory pathogens that tend to be more active during colder months, COVID-19's comeback in the summer months goes in to show that it may be potent enough to affect a large part of the population, even in hotter temperatures. Now, the immediate question is there a cause for concern yet? Singapore's health ministry has said in a statement, I'm quoting, that there is no indication that the variants circulating locally are more transmissible or cause more severe disease compared to previously circulating variants. Which basically means there is no need to press the panic button yet. However, while the resurgence is yet to match the infection peaks seen in the past 2 years, the previous experience tells us that COVID-19 is a virus which is not to be taken lightly and is not predictable. China, the country where the virus allegedly emerged in 2019, is witnessing stark COVID-19 spikes, in fact, almost nearing last summer's peak. A similar situation prevailing in Thailand, where 2 infection cluster outbreaks have been reported, with cases rising after April. This brings us to a key question. Should India be worried? The short answer is no. As per the Ministry of Health and Family Welfare, the country currently has only 93 active cases of COVID-19 and no significant increase reported recently, which means India could very well be immune to the new wave at this point. But can it be said that India will be pandemic-proof in the future? Not quite, especially with the situation evolving in different parts nearby. Given the nature of the virus as well, preparedness always helps, and it's always wise to stay one step ahead. Now's the time to watch out and also take precautions as advised in the local areas as per the experts, and also to stay informed instead of being alarmed. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.